Dr. Frachella. I'm really glad to see you today. Glad that you could take a few minutes to be with me. Um, I just want to thank you for all the time you spent with me over the years, especially at the beginning when I took a trip over to Bend, Oregon to visit with you, and how great that was. And you introduced me to SMART and how great that was. And so anyway, please, I'd like for you to share specifically today about how the gentle handlers has affected your practice when you're doing SMART. And so if you want to tell us a little bit about your background and how that all plays together, that would be great. Thanks. Appreciate it.
I'm a pediatric dentist. I've been practicing dentistry for about 45 years. For 32 of those years, I was the director of a free clinic for underprivileged children in Bangor, Maine. And I did drill and fill dentistry, needles and drills. And then I moved to Oregon, where you came to visit me. And I quit using needles and drills at that time because the amount of decay that I was seeing in Oregon was remarkable, because I was in the poorest county in Oregon and I was the director of a federally qualified health center, an FQHC. And I knew that I could not drill and fill my way out of the problems there. So at the time, I was introduced by Dr. Mike Shirtcliffe, who's one of our pioneers of smart dentistry and of SDF. I was introduced to SDF and he said, why don't you try this, John? Because you can't drill and fill your way out of the problem. You know that and I know that. So try this. It's a medical solution. I had no idea what it was. I used it. It immediately became apparent to me that I was controlling the disease, and the drilling and filling does not. And that was almost 12 years ago, if not a little bit more. And I've been doing nothing but controlling the disease and preventing the disease atraumatically since then. So that's my background. Now, to answer your specific question about handburs and evidence-based dentistry, we had no evidence-based dentistry when I first started doing this. The only evidence that we had was our clinical observations. And our clinical observations were that the less we invaded, the more we involved ourselves with non-invasive dentistry, not even minimally. At first, it was minimally invasive dentistry. Well, as we did more and more minimally invasive dentistry, we found that the less invasion we did, the better our results. Less sensitivity, we had less growth of decay, we had overall our outcomes were better. Less children using hospital emergency rooms and less children in the hospital for general dental anesthesia, which puts their life at risk. So then we moved from minimally invasive dentistry, where we were doing a little drilling, to non-invasive dentistry. And that's when handburs came in. And the reason that handburs are so important to smart dentistry is because they invade minimally. For instance, with a handbur, because it's not a contra angle, it's just straight up and down. One dentist in a lecture I gave in Idaho a few months ago held up the handbur because I asked him to, and he held it up. I said, hold that up so the audience can see it. He held it up. And I said, what do you see? And he looked at it and he said, a burr on a stick. Perfect. That's exactly the opposite of a contra angle. A contra angle is a right angle. Can you see what I'm doing here? That's a right angle. The contra angle allows you to go in and drill and then lift up and remove unsupported enamel. In smart dentistry, we do not want to remove unsupported enamel. That is the amputation, the unnecessary and actually misinformed, and if you will, it's malpractice. It's the malpractice of doing over treatment and or mistreatment, because that unsupported enamel that you were taught in dental school to remove because you were doing bondodontics with composite materials, you were taught to remove that unsupported enamel. That should not be removed because it can be remineralized. So the kind of dentistry that we're doing is SMART, silver modified atraumatic restorative treatment. That tells you what it is. It's silver modified art. So it's ART, but SMART is actually something more than just a silver modification of Dr. Jo Franken's technique. What it is, it's detection, it's arrest, it's remineralization, it's preventive, and it's antibacterial. So it's all of those things. So if, we say SMART, SMART, silver modified atraumatic restorative treatment, we could call this RAD-PAD, okay? RAD, R-A-D dash PAD. Now that would be, R would be for remineralization, A for arrest, P for prevention, D for desensitization, A for antibacterial, and another D for detect, RAD-PAD. Okay, that's what we're after. You don't get RAD-PAD by taking a contra angle to a tooth and removing stuff that shouldn't be removed. We've been taught in dentistry, and as a matter of fact, let's go a stage further. We are required by the dental board to show proficiency in doing what we should not do, in removing too much material that should be left in the tooth that can remineralize. Okay, we are required, in order to get a dental degree, to do the wrong thing, which is both unethical, unsafe, and malpractice. According to the new science and the information we now have, do we have evidence for that? You're darn tootin' we have evidence for that. And most of the evidence we have for doing silver modified ART, why apply silver? ART works. Let's just apply ART. You don't need the silver. Yes, you do. Okay, because we have evidence for the use of silver ions, tons of it. There are hundreds of studies now. There were none 12 years ago when I started doing this. Now there's hundreds from all over the world. Okay, so we have evidence for the use of SDF as an antibacterial, arresting, desensitizing RAD-PAD. Okay, we have tons of evidence, as Dr. Jo Franken will tell us, for the use of glass ionomer alone. And we have tons of evidence, as Dr. Jo Franken will tell you, for leaving decay in teeth, for minimal invasion, for not removing all of the decay that they taught you to remove in dental school, that dental boards make you remove that stuff to prove that you have proficiency in doing what you shouldn't be doing, removing that stuff, to get a dental degree. We need to change dentistry. We need to change the dental boards. We need to change the dental schools. We need to change. Everything needs to change because we have evidence for those three things. SDF, okay, number one.
Yeah.
Number two, glass ionomer. Number three, incomplete removal of what we used to call decay. It's not really decay. It's leathery dentin or leathery decay, or if you will, it's not infected tooth material, it's affected tooth material. So we certainly should remove infected tooth material. We can do that with a little cotton swab. That's that kind of mushy cottage cheese stuff. We can get that off with polyacrylic acid, for gosh sake, on a little micro brush. In other words, in one hand, you got the dental drill. In the other hand, let's take the micro brush. Throw away the dental drill. Pick up the micro brush. That's all you need. You don't need to be removing all of this stuff. Leave it in. And what we've proven clinically, which is evidence-based dentistry, our clinical observations are that we are creating super teeth out of decayed teeth, teeth that are harder after we apply SDF than they were before they became decayed. SDF affected dentin is 4 times harder than normal uncarious or whatever you want, sound dentin. So, what the heck, yeah, it may end up, we do end up with teeth that aren't perfectly white, and we don't necessarily want that in the front of somebody's mouth. But back here, I mean, come on, I'm on video here. What do you say? I got a bunch of gold crowns, right? But what do I have to do? Is that how we address people? Hey, look at my gold crown. We don't do that. Can we make those teeth dark? Well, they're no darker than an amalgam, and they're no darker than a stainless steel crown, and they're no darker than my gold crown. I got a couple up here too, but you don't see them. We're not saying we want to turn everything black. And the other important thing is that when we do smart, even in the smile line, later, after the decay is controlled, when money, time, and behavior, those three things, money, time, and behavior, three things line up. When those three stars line up, we can make your teeth white without needles and without drills, because now we have new glass ionomers that are hybrid glass ionomers that are as aesthetic as any composite we ever had anytime, and they don't cause cavities the way composites do. Composites cause cavities. They're cariogenic. Everybody is saying that now. All of the great godfathers of composite dentistry, of what we now call bondodontics, Gordon Christensen, Ray Bartolotti, Graham Milicic, Jeff Knight, all of them are denouncing composite and the removal of too much tooth structure as being cariogenic. It causes cavities. It isn't a treatment for cavities. It causes cavities. However, the rest of dentistry is in a runaway train headed straight for higher income, for their own personal higher income, doing what they were taught years ago and what is still being taught in dental school, and which is required by dental boards to do, which is wrong according to the science. Dentistry needs to catch up to the science. So we need to go into dental schools like McGill and dental schools like the University of Buffalo, where I'll be next week. We need to go into those schools and tell them this is misinformation. It won't be long before this will be declared as malpractice. Do you want to be in that bus, or would you rather be in our bus?
Would you rather be
doing the right things for the right reasons?
Would you rather be a healer or wheeler dealer? I heard someone.
Would you rather be a healer or a wheeler dealer? That's the whole thing. If you're going to be a wheeler dealer, you're going to get pinched very, very soon, ladies and gentlemen. You are not going to be allowed to keep doing this, because patients will not tolerate it, because they're going to know, because we're out there telling them. And you may want to see us go away, but we aren't going to go away, because we are devoted to the proper science of doing the right thing for the right reasons. And if you think for 1 minute we need more data and more studies on smart because there isn't enough evidence, I'm here to tell you I've done tens of thousands of these. And if they didn't work, if they weren't desensitizing, if they didn't arrest, if they didn't demineralize, if patients were dissatisfied because they were too dark or whatever else you're thinking in your mind, then you would already know about it. But you do not know about it because no patient complains, because it is a higher standard than traditional conventional dentistry. And hand burrs, gentle hand burrs, help to get us there, because they bring us to minimal, if not none, invasion. And they give us the proper access to the carious lesion itself, to the caries lesion itself. They give us the proper non-invasive access to get the essential medicines, according to the WHO. These are essential medicines of SDF and glass ionomer into that area to remineralize and to arrest and to be antimicrobial. RAD-PAD. Okay. It gives hamburgers, general hamburgers, allows RAD-PAD to happen, because otherwise we don't have access to get it in there. You know, if we could put it in a needle and just squeeze it into a tooth, but you know, it's not a tooth isn't an orange, you know. If it was an orange, we just squirt it in. Okay. So the burr on a stick. Remember the guy said, I got a burr on a stick. Yeah, the burr on a stick gets it in there. Got it?